Hello everyone, this is dr.simantini, practicing dermatologist, and today I would like to talk about treatment of acne. So this is the second video on the series of acne. In the first video, we discussed about what causes acne, what are the different types of skin lesions in acne, how do you get acne, and what are the trigger factors in acne. In this video, we will discuss about the different treatment options in acne. Majority of the times we get patients when they have acne scars or uneven pigmentation. It is very important to treat acne when you have active acne lesions. So when you have pimples, please get the treatment right away. Otherwise, it will lead to consequences such as scars and marks, which are more difficult and resistant to treatment. Now, the treatment of acne depends on the type of acne. So, when we see our acne patients, the acne lesions are classified as mild, moderate, and severe, and treatment plan is accordingly categorized. It is important to be patient with the acne treatment. Since acne is a chronic process, it takes 3 to 6 months for the treatment to show effect. The doctors, when they see patients, they give a stepwise treatment approach. At every visit, the treatment plan is revised and a step-up approach is needed if necessary. So doctors will include the procedures, add the drugs or change the medications depending on the response. It is very important to stick to a cream for at least 1 to 2 months before deciding to switch treatment because it takes longer for the cream to show effect. Also, it is imperative to include a good skincare routine along with your treatment plan, and you have to be consistent with it. You have to stick to your skincare routine even after acne lesions subside. Let's look at the treatment goal of the acne. The treatment goal revolves around 3 processes of acne. The first is reducing the oil production. The second is the normalization of the keratinization, that is unclogging the pores. And the third is reducing bacterial infection and the inflammation. So now let's discuss the treatment plan in detail. Coming first to the face wash or beta hydroxy acid, which is salicylic acid. Now this is a chemical exfoliant, that is they unclog the pores. Now if a person is on oral retinoid treatment, then skin tend to dry out. In that case, we have to change the face wash to a gentle cleanser that person is able to tolerate. Ideally, the face wash is used twice a day. So you have to wet your face with water, apply the face wash all over your face, leave it on for about 4 to 5 minutes and then rinse off your face. After washing your face, it is important to apply a moisturizer, which is meant for the oily skin. Coming next to the different types of creams that you can use in acne. The first is the topical antibiotic cream. Now, because there is bacterial infection and inflammation, these antibiotic creams, they tend to reduce this infection. So the common ones which are prescribed are clindamycin, erythromycin and nadifloxacin. Coming next to the benzoyl peroxide. Now benzoyl peroxide is a lipophilic medication. That means it gets easily absorbed in the fat cells. How benzoyl peroxide works is it's a comedolytic, that is, it is going to unclog the pores and also act as a chemical exfoliant. It also reduces propionibacterium acne. It is also anti-inflammatory. It also reduces the resistance of the propionibacterium acne. The benzoyl peroxide is available in the strength of 2.5 to 5%. It is available in the cream form, gel form, face wash. Now, benzoyl peroxide should be used gradually. That is, initially you start with a lower percent and then gradually increase the percent. Also, you can do a short contact therapy on the first few days just so that you're able to tolerate the medication. Coming next are the retinoids, topical retinoids, which consist of tretinoin, which is the first generation, adapalene, which is the second generation, and tazarotene, which is the third generation. The ones which are commonly used in acne are the first and the second generation, that is the tretinoin and the adapalene. Now, tretinoin is available in 0.025 to 0.1%. And adapalene is available in 0.1%. Now, how tretinoin works? They work by normalizing the keratinization, that is, they thin out the skin, they unclog the pores and clear out the debris. They also reduce oil production. So the face becomes less oily with the use of tretinoin. It is generally advisable to start it at a lower strength and gradually increase as per your tolerance. Initially, you can do a short contact therapy, for example, for 1 to 2 hours, and then as and when you are able to tolerate, you can leave it overnight. Thus, retinoids are mainstay in the treatment of acne. You have to be very careful in using retinoids in a sensitive skin. The next is the azelaic acid. Now, azelaic acid is an organic acid that is naturally present in wheat, barley, rye, and is prescribed in acne. It helps in reducing the pigmentation because it is a tyrosinase inhibitor which causes pigment production in the acne. It's also an anti-inflammatory medication. Coming next is the oral antibiotics, oral retinoids, and hormonal treatment. Coming first to the oral antibiotics. Oral antibiotics that are commonly prescribed in acne are azithromycin, doxycycline, minocycline, and tetracycline. Now these help to reduce the bacterial infection, that is, they decrease the Propionibacterium acne, which is the organism responsible for acne. The second ones are the oral retinoids. The oral retinoids such as isotretinoin are commonly prescribed in acne. They decrease oil production, they are comedonlytic, and also help to normalize the keratinization. They are given only under medical supervision, cannot be taken in those who are planning pregnancy or around the periconception period. Now, oral retinoids are generally given when you have severe acne such as nodulocystic acne, cystic acne, or even treatment-resistant acne. Third consists of the hormonal treatment, which includes spironolactone or the oral contraceptive pills. So these were some of the oral treatments. Coming next to the procedures that are performed in acne. The first is the comedone extraction. That is, when you have this whitehead and blackhead, these have to be extracted under sterile conditions. You have to take a steam for at least 5 minutes prior to the procedure, which will help the surrounding skin cells to become loose and make the extraction process easier. The second is the chemical peels. The chemical peels that are commonly used in acne consist of salicylic acid peels or glycolic acid peels or even lactic acid peels. The third are the light treatment. They consist of the red and blue light treatment. Now you have to be very careful in those who have type 3, type 4 skin, as they tend to cause pigmentation. It is also imperative to stick to a good skincare routine in addition to the treatment plan. Also, the lifestyle changes, that is avoiding processed food, refined food, or the dairy products in your diet, exercising 30 minutes daily, drinking enough water, staying hydrated, and lowering your stress will also help in treating acne. In my next video, I will be talking about tips that can be followed in those with oily skin or the acne-prone skin. If you think such content is of interest to you, then please subscribe to the channel and stay tuned for more videos. Till then, stay safe, stay healthy.